afternoon, everyone, and welcome to the Pittsburgh Current Podcast Quarantine Edition. I want to thank my friend and election night co-host, Aaron McClellan. Sorry, we're all getting a little punchy. Aaron McClellan for last week for her interview with U.S. Rep Mike Doyle. I appreciate her for stepping in last week. The new issue of the Pittsburgh Current is on your computer and in your emails. We are going digital for the time being because we figure there's no one out there to read papers anyway. So we'll keep it green and we'll keep it online for now. We'll have a new issue coming out. Remember, we're coming out weekly now, so you'll have a new issue coming out this coming Tuesday. Also a reminder that if you like what we're doing at the Pittsburgh Current and you want to support independent journalism, we are currently having a fundraiser, and we currently have a program where you can get an exclusive skyline print from our own Jake Mizlivchik with a donation of $50 or more. So you can check that out. I believe the information Jake is putting up on the screen for you. So check that out, and you can also find that information on our homepage. So pretty much all of our coverage, all of our attention has been on the COVID-19 crisis in one way or another. And one thing that I've been writing quite a bit about, and some public officials have been really looking at, is the response to the COVID-19 pandemic at the Allegheny County Jail. And joining us today to talk about that is Allegheny County Controller Chelsa Wagner and Brad Korinsky, Chief Counsel for the Controller's Office. Welcome, guys.
Hi, thanks for having us.
So, Chelsa, let's start. I mean, there's so many things to talk about, I think, when it comes to this case, when it comes to this issue. First of all, you released a statement in the last day or so. So they're all, I'm sure you guys are finding too, they're all running together the days as you're not leaving the house. But that there basically needs to be more transparency at what's going on at the Allegheny County Jail. Let's start there. Start with what kind of information are we not getting, and what kind of information does the public deserve to know?
Well, I think the public in this situation with any of our public institutions really needs more information and not less. But I think we're all being held to this need-to-know basis on what is going on at the jail, and probably not even getting some of the information that we really do need to know. And it's been particularly concerning because I, by my position as controller, am part of the jail oversight board. And even that entity has not received information. And one thing I think speaks to this, I was speaking to a reporter yesterday, and he read for me what was probably about 2 pages of a release that came from the county administration saying that there are rumors, but it did 2 pages, I don't know if you saw this, of explanation without providing any information. Unfortunately, there's been a long pattern of this at the county jail, and now where we have a situation, I think, that is really unique, because previously you could argue that whatever went on at the jail where there was wrongdoing or questionable procedures, it was contained in the jail. And now we're in a very different situation, and we're still not getting information.
So a very interesting fact about that press release yesterday is I believe I was the onus of that. I sent a very detailed 10-question email on a story that I'm working on, and there were no questions about what I specifically asked. 10 questions in writing, and that was what was sent out in response. And then I received another email that said that was their response, and without responding to any part of the 10 questions. And so I know as a journalist, a lot of us are asking, like, we're getting information on a lot of other things. When we call, we ask, we get the information on lots of things. But the jail situation seems to be something that they're seeming to hold very close to the vest. And I guess I don't know really, I'm not sure why, because again, yes, it's a jail, it's incarcerating individuals, but there are still county residents and other people in that jail who are susceptible to COVID-19. So to keep all of that sort of what they're doing seems a little strange to me, at least. And as you two, as a member of the oversight board, you would think that you would at least have more information than the rest of
Right.
us.
Absolutely. And I think that by not providing information to journalists and even to elected officials and members who are really charged and have a statutory duty
Yeah.
to protect the health and welfare of those in the jail, this is causing more harm than good,
Mhm.
this opacity and not providing information.
Um, so there's obviously there's information, as you said earlier, when you're dealing with a jail, a confinement, a place of confinement where security is a big deal. Do you still feel though that there are ways that information should be, the types of information, I guess, that should be given to folks, should be released in some form or fashion?
Oh, absolutely. I think this goes to everything. I certainly am pleased that the courts and the other entities did act quickly, and that they did really have done a lot of work in terms of releasing. By count, I think today is still over 700
No.
inmates in the jail. But even if you take that, which was a good example of governmental entities working together, we should have understood what was the plan. We still
Right.
don't know what is the plan. Is it
Exactly.
still ongoing? We've heard, and Brad can probably speak to this even better from our office, of some of the federal public defenders, and some of the challenges with the federal detainers for those individuals with a federal detainer who are being held in the county jail. So there still are a lot of questions, and I think I've certainly looked to other states and
Right.
leaders who I think have been very, very good with communication in this crisis. And there are those lessons of crisis communication, and you have to be clear and you have to give information. I think we all understand that there are going to be some areas where, maybe there's a little bit of protection of information, but it's really a disservice to our entire public and community, just doing this, by such a broad brush and really not providing any information.
Right. That's actually, Brad, that's actually something I had heard too, that there were some folks at the federal level who were federal public defenders who were kind of upset that they didn't know what's going on over there.
Charlie, I was surprised to learn that we have over 300 federal detainees in our jail.
Wow.
And I think oftentimes when we give the breakdown of the jail population, those federal detainees aren't included.
Right.
I was surprised to see such a sizable population, and they aren't affected by a lot of the release orders that have gotten recent media attention.
Right.
And we have federal judges who believe, well, everything's all right in the Allegheny County Jail, and it's a perfectly safe place for those folks to be.
And I think that something, Chelsea, you mentioned earlier is, so we released 700 inmates, give or take a few. So you're right. So I would think that that's the perfect example of, okay, so now what's the plan? Now that you have space, what kind of space? And what are you planning on? How are you planning on implementing things? And I mean, honestly, I've heard at some point, I think that when things are called rumor and misinformation, when you have journalists who are calling up with, I know personally, the questions I asked yesterday were sourced by 2 or 3 or 4 people, and and a lot of them went to the point, the question of what are you doing? And it seems to me that there's a very defensive tone coming out of there, and that seems to be the perfect thing that they should be talking about. Okay, we released 700 prisoners. This is what that means to you.
Right. Well, I can put this even, I think, in a larger context
Yeah.
from what I've seen over 8+ years as controller. I think this administration has really worked to not provide information when there's a public health issue. And I would cite examples ranging from lead in the water to air quality to even the opioid epidemic.
Right.
And so you see that pattern, and it's always existed with respect to the jail. And so I think that, just in that kind of fiber of the way that this administration has operated, you are really seeing it most clearly right now, and how really threatening it is.
Right. And talk about that, actually. Let's go into that a little further, because as several, probably, I guess maybe it's going on 2 weeks now that you and other officials first called for the decarceration of the Allegheny County Jail. One of the things that was said by yourself and some others was, first and foremost, was, look, on a good day, the jail has its problems, pretty significant problems. So go into that a little more. Talk about historically, I guess, what's happened, a little bit more of what's happened in the past that has you even more concerned now that we're in this crucial, this pandemic. What have you seen that leaves you even more, wondering, craving, I guess, more information to know that the right thing's being done?
Yeah, I think you can see that across the board. You can look at it in basic sanitation issues. Those kind of things aren't necessarily so unique to our county jail, but the healthcare issues certainly have been. And so I cited the example of how this administration really hasn't been responsive. And looking historically as a jail board, this administration really behind closed doors hired this massive private healthcare provider, Horizon. And it wasn't until journalists were asking questions, our office did an audit where we were able to demand information, that then it took that administration to turn things around. And so now where we have Allegheny Health Network, we still have, and we've been documenting this for probably going on 3 years now, major shortages in terms of our healthcare positions, some really key positions. And so I think when we know that as a baseline, we need to understand very specifically what the plans are, even questions of just basic protective gear that's coming up, not just with the medical staff, but also with the corrections officers. We need to know what kind of supplies they have.
Right.
If and when they do a test, how is that going to be administered? And these are questions that we know are questions in the larger community. I have a friend, interestingly, who told me today that, and she's a medical professional herself, her son has been waiting for 11 days for test results.
Wow.
So, we know what are problems, massive problems in dealing with this virus. And I think when you look to the setup of any jail, let alone the specific challenges our jail has had,
Right.
we know that they only become larger and hopefully not exponential, but we know just the standard and we know all the contact. And we're hearing things piecemeal. Unfortunately, we're hearing mostly from a lot of concerned corrections officers.
Yeah, myself as well.
Right. Some attorneys. And, we are not being critical to be critical, but this is a public safety,
Right.
major public safety issue. And, we do need information and we need all hands on deck to best prepare because, the clock is ticking.
Right.
And if we don't have a big problem there right now, I think the data tells us that it's right around the corner.
Right. And I think that that's an excellent point. The history of healthcare at the Allegheny County Jail it's not a blue ribbon history that they have. I mean, literally, however long it's been, a couple of years now, people started dying before people started noticing that the healthcare quality at the county jail was not up to par. And so I would think that would make it even more, crucial that they're answering those questions of, okay, you've had these hurdles in the past. Now that you've got this huge hurdle in front of you, what are you doing to solve it? And it would seem to me that would be a no-brainer as a question that should be answered.
Exactly. I think that it's only to this administration's advantage to be forthcoming in answering these questions.
Right.
I mean, I will say that they've never taken political advice from me, but I think both politically speaking and also in terms of public health and public interest,
Right.
that is the winning solution. Share the information.
Right. Brad, from a legal standpoint, and this might not be something that you've studied. Obviously, when you're dealing with folks who are incarcerated and then you're dealing with healthcare issues, there are laws that govern what can be said. But is there anything really legally that's keeping them from sharing pretty basic information about this?
Well, Charlie, I mean, certainly there are HIPAA hurdles to overcome
Sure.
that would prevent us from learning information about individuals. But I think that we have two tiers here. We have first, the Jail Oversight Board is statutorily obligated to ensure the health, welfare, and safety of inmates in the jail. So they are obligated to share with the Oversight Board a certain quantity of information.
Right.
And then you could say, well, maybe all of that doesn't get shared with the public, and it may not be appropriate to do so. But certainly the body charged with oversight should have it at a minimum. And
Statutorily speaking, I'm sorry, but statutorily speaking, what is the board entitled to? I mean, because again, the April meeting, I mentioned that earlier. You guys had a meeting, Chelsa, scheduled for this week, and that meeting has been canceled. I know that there's now a push to try and get that meeting rescheduled for later this month. But obviously, you would have had a ton of questions going into this meeting. So statutorily, what information are board members entitled to that they're not getting, either before a meeting or now with no meeting, information that's going to be kept from them even longer?
Yeah, I mean, I'd certainly defer to Brad on this, but I would say that the statute in and of itself, at least my readings of it, is pretty broad.
Yeah.
So I don't know if the statute itself, it speaks to the information. There may be some instances of case law that Brad may have a better knowledge of than myself. Information has been provided to the board at our regular monthly. Everything from the health statistics, numbers in terms of intake, new inmates, different health statistics in terms of everything from sexually transmitted diseases to pregnant inmates.
Right.
So it's a long list, a lot of information from probation and parole, as well as from the other partners that the jail works with, such as the reentry programs and other providers. So it's very, very broad. And I think what we've been offered by the chair of the committee is to provide questions in writing. But really, I don't have great faith that they are going to be answered, because Brad has certainly, not only assisted, but has led a lot of the efforts from our office, because, you have to really be sitting at a table, because otherwise I fully expect, based on past practice, that we are going to get a very evasive non-answer unless we're able to sit there in a public meeting. And the other thing is, just under the rules that allow for executive committee, there is absolute ability, and I presented this to the board about 10 days ago, that we could go into executive session. And there are different parameters, a finite list of what is allowed for executive session. And one of those is public safety exceptions.
Right.
And so we could have made sure that the board was getting the information and getting answers to our questions. But at the same time, understanding that if any of those were too sensitive for just general public knowledge, we can all handle that. That's
Right.
our role as board members.
Charlie,
Yeah.
I throw out an example. I bet Port Authority board members know how the buses are getting disinfected,
Right.
but jail oversight members have no idea of the disinfection measures in the jail.
Yeah.
And the public knows. I mean, as far as the bus, your Port Authority is one of those agencies that's sort of every step that something is, they've either changed a major policy or changed a major way they do business. They've let the public know, and it just seems like the natural thing to do. But it's just, I know we're dealing with incarcerated individuals. I know we're dealing with security issues. But again, as you've said, you're hearing from people who work in the jail. Reporters are hearing from people who work in the jail. They don't feel safe. And that's the overarching feeling that a lot of folks have said to me, and I'm sure you've heard the same thing. They just don't feel safe, and they feel like there's not a solid, they don't feel that there's a solid plan in place to deal with this. And there may be, but a lot of them don't know it either, which is kind of frightening. So Brad, I want to talk to you a little bit. So at the last county council meeting, county councilors Olivia Bennett and Bethany Hallam introduced a piece of legislation that would have mandated the release of several types of inmates from the jail. For example, those alleged to have committed a technical probation or parole violation, those alleged to have violated probation or parole, anybody charged with a misdemeanor and awaiting trial, anybody charged with drug possession, sex work, or other nonviolent offenses. So they get ready to bring this to council, and county council gets a legal opinion from its own solicitor that they don't have, the county council doesn't have the power to enact this legislation and doesn't have the power to to force the county executive to enforce this ordinance. You wrote an opposing legal opinion. Talk to me a little bit about that ordinance, and talk to me a little bit about how a lot of what you wrote in that opinion goes to sort of some of the issues with county council's oversight of the executive branch, sort of that checks and balances thing.
It was an opinion that really sought to exhort county council to free itself from seeking the executive's permission each time they pass legislation. Because if you look at the solicitor's opinion for county council, it basically said, don't bother doing this because the county executive isn't going to implement it. Therefore, this legislation's a nullity. Right. Which, if that were the case, we would have legislatures throughout our country and throughout our history never pass anything. Right. We wouldn't have Social Security, that's for sure. Right. I mean, you could go through the list. And the fact of the matter is, had council passed that, it would have put everyone on notice that this was tremendously important to council. Obviously, council couldn't go to court for every person in that classification and demand enforcement, but it would have at least required a mechanism of accountability so that a report could be made to council at the next meeting. Here's the progress that happened. I mean, certainly council, to take it to the extreme, couldn't mandate that each person from that jail be released. But as a matter of policy, they could certainly demand that the county collaboratively work with other involved entities to ensure the best possible outcomes. And that's what that legislation demanded, which again is no different, Charlie, than other legislation like MWDBE limits or prevailing wage or anything else the council says this is important. Here's an aspirational goal. And why on this, a line in the sand was drawn that it could only be voted on if there was guaranteed implementation. Right. Boy, that seems to have vetoed council's legislation before the executive had a chance to do it.
Right. And it really does sort of, I mean, we're kind of going around the kind of the main issue, which is one of the criticisms of county council in recent years has been the fact that it's, I don't like to use it because they get offended when you use the word rubber stamp, but that claim has been made that they're a rubber stamp for what the county executive wants to do. This would have seemed to be, number one, this could have been legislation that they could have initiated, because at the heart of it, it's not really doing anything that's super crazy or subversive. It's basically saying, let's get people out of harm's way who don't need to be in harm's way. And secondly, it just sort of, the fact that they didn't even vote on it for discussion, and it was immediately sort of sent to committee, and I guess it will come up Tuesday evenings. Again, I don't know what day it is. Tuesday evening's council meeting, but it's likely to come up possibly like a non-binding resolution potentially. So those are the things. So it doesn't seem to be. This seems to be a place where, number one, could have been a place for county council to sort of step out. Number two, it seems to just sort of exacerbate that image that the county executive calls all the shots in the county.
And I think that that's the larger problem. at times when you really need, and Brad and I have discussed this, that you need your boards functioning. This is what we're seeing. The thing that we always knew to be true is that the decisions, even when you have boards that operate under federal law or state law, they are still being directed by one person who's calling the shots. And frankly, this is too big of a problem for one person to handle. And so even in other areas, I've been saying this administration needs to allow and empower the department heads to do what's best for their respective departments. In that example, you see so many that it's not the best term, but it's non-essential employees. It's the people that in private business are being required to stay home. But we have county employees who are being forced to work and do menial tasks that aren't even their normal tasks just to force them to go in. And so you see a lot of really concerning actions within this county administration across the board that are completely counter to its public messaging, which it's constantly repeating that we all need to stay at home. If you can stay at home, you stay at home.
Right.
And so I think the problems, the rhetoric all across this is not matching the actions of this county administration.
And I was going to ask you about that. I was going to ask you about the fact that the people who are compelled to come to work and who are compelled to, they don't get the choice whether to work from home because they have essential jobs. And again, I know that some of the things a lot of different folks from a lot of different sectors have spoken up. We had the refuse workers speaking up and said, where's my gear? Why am I not getting, honestly, on a regular basis, probably refuse collectors should have that kind of gear. Let's go into that a little bit more. What are some of those areas that you see people being forced to work that probably don't need to be there necessarily?
Yeah, I think it's really across the board. And so people have asked questions, is this unique to the workers within the county? And we have over 6,000 county employees in total. Is this unique to those people who are doing desk jobs, or is it unique to people who are out in the field, many of our laborers and other categories? And it's really across the board. Some of these departments have told me initially, and this is true with some of the folks that are in the field, such as at our county parks. We're told initially that they were at least going to do a staggered work schedule so that they would limit contact and have more, not a full complement, basically, on the job. And then that was changed immediately. So we've heard people saying, I'm having to be in this facility. I have 10 or so people around me. We have one sink. We don't have any equipment. People are riding still in cars or trucks, work vehicles with 2 individuals on job sites from last I heard. But, just so many examples. But and maybe it would all be different if these were the jobs like the corrections officers, like bus drivers, certainly like healthcare workers or grocery workers who are really under that essential category. But we know that the best thing we can do to protect those workers is not be out crowding them in public spaces right now. So it's really, really frustrating, but it really is across the board. And I've been careful not to specify too specifically the individual departments because, or roles, because these individuals, especially in what not just our healthcare, the state of our country and world right now, they're more scared than ever about losing their jobs. So unless somebody has said to me, hey, say my name and use my example, I've promised them that I would do it more categorically.
Right. And that makes sense. And just sort of as we wrap here to bring it kind of back around, they said those essential employees, those employees in the jail are essential employees. They need to be there. They have to be there. So then I guess just sort of in summation here, doesn't that then make more sense that there's more information given on what the plans are? And it even seems like a lot of those employees are on a need to know basis. And so don't you think that even more speaks to the fact because they don't have a choice. There should be more information about what's going on at the county jail.
Absolutely. And they're all at great risk, and we're seeing publicly how undervalued our essential workers are, be they delivery personnel, to your grocery store workers, to certainly healthcare professionals. But I would ask Brad. Brad, I think, has cited a really good analogy. Brad, if you'll share the concept of the cruise ship. And I think you state this best in terms of how we think of what's really going on at the jail and how these workers are really exposed, but also how it exposes our whole general public.
Yeah, Charlie, I've used and tried to get information from the jail initially. I compared it to a cruise ship anchored off First Avenue, except it lets people on and off with regularity. And it's terribly concerning because I think our numbers in Allegheny County, let's say we get through the next couple weeks, all right. But the potential for outbreak is there at that county jail with all of the correctional officers, all of the employees, the food service workers in and out of that facility. And, also, Charlie, what would happen if an inmate has to go to a hospital? Are we going to have a corrections officer or a deputy sheriff who's going to have to go into the hot zone with that inmate?
Right.
And what is that going to look like in terms of safety and security? And that's an unanswered question that no one on the jail oversight board, to my knowledge, could actually answer. And I think folks in the jail, at least if they knew, well, people that are charged with ensuring the jail's operating safely know of a plan, perhaps they'd feel a little less nervous that there's not a plan.
Right. And that's kind of it. It's just, Chelsea, to give you the last word. That's kind of it. It's these are people who are given no information. I mean, we think we don't have information. The inmates in that the incarcerated folks in that jail, they have no information. They get what they get off of, through hearing things or what they might see, but like maybe on TV or whatever. But they really don't know what's going on. So, do you think that kind of ups the ante in terms of why folks need to sort of demand this information be made public?
Without a doubt, because I think, maybe the general public doesn't always think of what the jail population looks like.
Right.
But, one thing that we know, and this is true not just in our county, but it's a sicker population. It's people that have different health conditions, mental disorders, and so forth, substance abuse disorders, and all across the board, it's a sicker population. And I think when we just think of people in our lives, how people are panicking, think if you're locked in a cell without information and, for their families, I think this is really just worsening things in a way that puts the workers of that facility at even greater risk. So when you have people, I see very, stable people in my own life who are losing it. And that's to be expected. This is something that none of us have ever experienced before. And so I think we really, really have to be cognizant and mindful of how vulnerable that population is, and therefore how vulnerable everybody is who is there working and really not getting, be it the pay or the protections that they deserve for doing that real public service for us right now in a time that's most important.
Chelsa Wagner, Brad Karinsky, thank you both so much for coming and joining us today. And stay with PittsburghCurrent.com. We're going to keep on the story and honestly get as much media as you can at this time, because I know everybody out there who's doing this job is trying to get the right information and get as much information out to you as we can. So support your local news agencies. Someone's very persistent. Anyway, Chelsa, Brad, thank you very much for joining us. This has been the Pittsburgh Current Podcast. Have a safe and healthy week.
Thanks, Charlie.
Thank you. Yeah. Extra, extra, reading the issue. Raw news, unapologetic, no tissue. Catch the wave, the flow first certain. Nothing pull you in like a Pittsburgh.